Hello, I'm State Senator Capri Cafaro. Welcome to Ohio in Focus.
Hello, I'm Mike Rao. Welcome to Ohio in Focus, the program that brings state government to you. Our focus today, the state transportation budget and Medicaid, two issues that are top priorities for our guest, State Senator Capri Cafaro. Senator Cafaro is the ranking Democrat on the Medicaid, Health and Human Services Committee and the Transportation Committee. Senator, thanks for joining us.
Absolutely. Thank you very much for having me.
Well, I mentioned the two topics we're going to discuss. We'll begin with Medicaid expansion because as we're taping this program, we've learned that the House of Representatives have taken Medicaid expansion out of the budget. First of all, your reaction to that?
Not surprised, but certainly disappointed. It's never a good day in government when partisanship and ideology takes precedence over what's best for the people. And I think that this is a classic example, unfortunately, where partisan ideology, fear of labels such as Obamacare have eclipsed what's really important, and that's making sure that we utilize these federal dollars to expand access to healthcare coverage to many that don't currently have it. Including childless adults that are not part of the Medicaid eligible pool at this time. And it's something that's very important to our economy as well. I'm from northeastern Ohio, where we have a lot of jobs that rest in the healthcare sector. And, if we don't have this kind of funding, we potentially risk layoffs as well.
You talked about the effect on the people, too, and there's like 275,000 that would get health care if we did Medicaid expansion. This is a cross-section. I mean, this is all over Ohio that these 275,000 people would come from, including veterans and different groups. The other aspect you mentioned is hospitals, and it seems like they've come out pretty strongly in support of this. Do you think that support will continue, and can you see something changing on this issue?
Well, I certainly hope so, and I believe that cooler heads will prevail. At least I'm cautiously optimistic that cooler heads will prevail in the Ohio Senate when the budget comes over in the next few weeks, and we readdress the issue of Medicaid expansion. It certainly is my hope that advocates, whether it's individuals from representing the Ohio Hospital Association or individual providers, talk about the impact that Medicaid expansion or lack thereof will have on, again, their provision of care and them as employers. And this is very important and something that I don't think a lot of folks may realize. But the Affordable Care Act, when it is at the end of this calendar year in 2013, it calls for a phase-out, essentially, of funding that is provided to our nonprofit hospitals with a mission to provide care regardless of your ability to pay. They get money from the federal government called a disproportionate share payment. Here in Ohio, we call it HCAP, and that helps basically supplement the cost of giving care to those that can't afford it. That money is going to go away at the end of this year. And without Medicaid expansion and without, robust participation in the health insurance exchange as well, those hospitals are not going to have money to replace those lost dollars, and it's going to result in potential layoffs as well as reduction in staff that's going to lead to poorer patient care.
And when hospitals have more patients who come through their doors that don't have insurance, that's a cost they have to absorb, or it's a cost they have to pass along. And what's the effect on just the normal insurance user?
That's right. Well, we see what is already happening in the current marketplace. That those dollars don't just come from the sky. In many instances, the costs associated with providing indigent charity care to those that are using the emergency rooms, basically as their primary care home, that costs a lot of money. And for those folks that are privately insured, have their own insurance, they share the cost burden because they're the ones that are in the risk pool. And if we don't try to rectify that by including additional people that would receive coverage, we're going to continue to burden that cost by those that do have health insurance.
And is there an impact on small businesses too out of this?
I would think so. Small businesses, if they don't have an opportunity for their employees, for example, or others, to be able to participate in a Medicaid expansion or have any kind of reductions in their ability to participate in the exchange, that certainly could have a detrimental impact on those that are working in small businesses or small businesses that somehow are related to the healthcare sector. Both are going to be, I think, adversely impacted by the absence of Medicaid expansion.
So what do you think happens now?
Well, I think a few things happen. I certainly encourage all stakeholders that are touched by this, whether they are hospitals, primary care physicians, the mental health community, which, while the House did allocate some additional dollars for mental health, it certainly does not address the needs at the local level for those that would need additional services in addition to Medicaid, transportation, and other things that may not be directly funded by Medicaid. So all of those folks, employers, and I think it's also worth mentioning that the Ohio Chamber of Commerce actually supports Medicaid expansion because it is such a significant impact on Ohio's economy. All of these folks need to come back to the table and engage those of us who serve on the Medicaid Subcommittee of Finance and try to, again, as I said earlier, have cooler heads prevail. That this is a matter not only of protecting patient care, doing what's right for individuals, being able to provide them with adequate access to preventative healthcare services, but it's a matter of dollars and cents as well. And I'm hoping that we'll be able to restore Medicaid expansion here in the Senate and certainly open to compromises. There's been a few things floated out there, like having the state enroll in the federal exchange to provide coverage to those Medicaid beneficiaries up to 138%. That's certainly an option. I don't think an optimal one, but an option nonetheless. And so I'm cautiously optimistic that the Senate will do the right thing.
And aren't these federal dollars that if they don't come to Ohio, they'll go somewhere else?
Absolutely. And that's one of the things that frankly, even Governor Kasich has brought up, and many of my colleagues, Republican colleagues in the Senate have mentioned as well, that, these are federal dollars. We as Ohioans, as well as the rest of the nation, pay our federal taxes. They go to Washington. And why not get those dollars back? They are there. This program of Medicaid expansion is paid for 100% for the next several years, and then will be reduced down to a 90% cost share with states. But that is our money, and we should be utilizing it appropriately to extend that care to Ohioans in need and make sure that our healthcare sector as a business continues to stay robust.
Also wanted to touch on the transportation budget.
One of my favorite things.
Yeah, absolutely. You're ranking member on the Transportation Committee. The big issue this time was the future of the Turnpike and how revenue would be generated from the Turnpike that would lead to road construction projects across the state. You voted for it. What did you like about this?
Well, you mentioned the Turnpike, and as someone who represents a portion of the Turnpike in northern Ohio, the interchange at Route 5 in Warren there, right in Trumbull County, I was very concerned about the fate of the Turnpike. And, with so many folks in northern Ohio as the primary users, first, we were certainly concerned about any discussions about privatization, actually, engaging in a long-term concessionary agreement to turn over that asset. That was ultimately not the decision that was made when the transportation budget was introduced, but some of those provisions and promises about keeping the dollars that would be generated through this new plan, which would issue bonds against future toll revenues, there weren't any guarantees that money would be reinvested in major new construction in Ohio. In the Senate, once again, we were able to work in a bipartisan manner to protect the interests of those in northern Ohio by making sure that those future revenues generated against the tolls would stay in northern Ohio, up at least 90%. Would stay in northern Ohio for major new constructions, and we defined what that really means through what we call a nexus. And that nexus is defined now as within 75-mile radius of the Ohio Turnpike. So if there's a major new construction project all the way up in, as far north as Conneaut, which is part of my district. Can't really get any further north than that, right on Lake Erie, and then further south, pretty much down to the Route 30 corridor. Any major new construction, and I want to be clear, this is not going to supplement or supplant any motor fuel tax that is currently being used for the traditional road maintenance that you see in your communities. This is specifically for major new construction that is already designated in the pipeline to hopefully be constructed here. This money, about $1.3 billion, would expedite the completion of these major new construction projects within 75-mile radius of the Turnpike.
You were also successful in getting an amendment to the transportation budget, which was a big concern in your district, is the fate of the travel centers that are along the borders.
Yes, I mentioned the city of Conneaut a little bit earlier. Conneaut is our gateway in the north. We border Pennsylvania, and Interstate 90 goes right through Ashtabula County, and that's a very, very heavily traveled corridor, particularly internationally. We had a travel information center. We have a travel information center there as you enter in to Ohio from Pennsylvania, right there in Conneaut. And there were concerns, a lot of concerns raised by the community in Ashtabula County, the Conneaut City Council, the Port Authority, and the like, about what the fate of that was going to be and if it was going to be able to continue to have some staff present there. I was successful in allocating up to $250,000 from the ODOT to staff the travel information centers at the borders. Now, granted, it's not for all of the travel information centers in the state, but it certainly is at least a step in the right direction to preserve the services that are at our gateways on the Ohio borders. And certainly, I think was a really positive movement for the communities that I represent on the borders.
Okay, Senator, we're out of time. Thank you for joining us again.
Thanks for having me.
Well, you can follow Senator Cafaro and all the members of the Ohio Senate Democratic Caucus on Facebook, Twitter, and at ohiosenate.gov. Thanks for watching Ohio in Focus.